Hello, I'm Margaret Robinson, the Associate Director of the Office of Interdisciplinary Programs and Office of the Vice Provost for Academic Affairs and Faculty Development. Today's presentation will focus on our Unity Clinic. As part of the mission of the Office of Interdisciplinary Programs, we look to the World Health Organization framework to improve health outcomes by improving how health professions learners learn to team while they're in their educational programs. And as part of our accreditation requirements, we look primarily at those hands-on activities of how learners can come together in a team environment and provide patient-centered care. To that end, in 2012, under the direction of Dr. Peggy Wisdom and our small group of core faculty leaders, we created the Interprofessional Clinical Experience. At that time, it was referred to as EPIC, Empowering Patients Through Interprofessional Collaboration. And as we'll learn today, we have now transitioned to a student-led model for the interprofessional clinical experience that we refer to now as Unity Clinic. We feel that it's so vital to engage learners as the team members that they are in designing this paradigm shift of how we not only educate health profession students, but also bridge the gap into practice so that our graduates can become those unique and distinctive change agents that are going to go forward and impact patient care in a meaningful way by collaborating well with others in the healthcare team and really putting patients at the center. So join us today as we hear from Daniel Gibrelli, Tram Lee, and Addison Davis to learn more about the Unity Clinic model.
Thank you, Margaret. It is such a special privilege to be here. I've been looking forward to an opportunity to share the work that we've done for the past 3 years, and I don't think there's a better platform to do it than here. The work that we've done would not be possible without the support of folks like Margaret Robinson, who has been our champion from the beginning, Lynn Goldston, who is the trailblazer allowing students to be incorporated into the interdisciplinary activities, as well as the people that make it happen, such as Sarah Cable, the entire Office of Interdisciplinary Programs, and our exceptional student leaders, Addison Davis, Tram Lee, Jamal J. Basu, and a lot of others who made today possible. All right, so I'm gonna share my slides and talk about the work that we've done for the past 3 years. So our experience started in the spring of 2018 with the idea of creating an interdisciplinary mobile student-led clinic. And this was made possible by a handful of students coming together and believing that together we can have an impact on our school, our community, and our state. With that, we created a mission centered around promoting clinical interdisciplinary collaboration and providing high quality care to the underserved populations of Oklahoma. And we created 3 milestones. First was to create a sustainable, replicable, and standardized model that allows students to participate in a meaningful way within a clinical setting. Integrating that work within the Health Sciences Center and making it permanent so that it continues to live on in a sustainable way in the future. And then lastly, taking the work that we've done and taking it on the road, living up to our initial vision of having a mobile clinic. So there were a lot of folks that made this possible from the beginning. We had a lot of different students from different colleges and different perspectives that came together, allowing us to make this happen. And the reason that this is so significant, the fact that we were able to have 18 different professions come together and make this happen, is that there is a lot of evidence out there and a lot of programs that typically have only 2 healthcare professionals, which are usually in a classroom setting and not in an actual clinic setting. And some of the published work talks about 5 professions working together in a clinic setting. And we were able to accomplish far greater incorporation of these professions in a meaningful way into our clinic. We were able to incorporate 8 different colleges, 60 students, and 18 professions into our pilot. And the primary charge of creating a sustainable, replicable, and interdisciplinary student-led clinic was taking place at that time. So we wanted to define what meaningful experience was, which meant to us that students had an active role in patient care. They were a valued member of the team. They were able to lead in their area of expertise, and they were able to learn clinical skills with real-world application and practice person-centered care. So there were a lot of design considerations that went into this. Our team had to take into account the resources that we had from the student side, from the clinic side, from the provider side. And with that, that required all the 60 students coming and meeting over 70 times in the span of 3 months to come up with a structure that allowed us to meet the goals that we had set previously. The culmination of the work that we did allowed us to finally come together and host our clinic in a effective way by having a detailed plan of what the team was going to look like, what the flow was going to look like, the responsibility of each of the different students, when they would show up to clinic. And we piloted our work in the spring of 2019. The overall experience was overwhelmingly positive, both from our students, the feedback from our patients, as well as the providers who were on site and the faculty that worked with us. And things were going well until COVID-19. And with that, we had to quickly transition our work so that we can accommodate the need for the interdisciplinary education with the important task of protecting our students, our patients, and making sure that we're able to deliver the care in a safe way. So what we had to do was restructure the work that we had done, and we had to do it relatively quickly. So we brought together a core team of students that were going to be able to participate in the clinical experience and/or were serving to ensure that every single voice was heard in the room as we went and incorporated the changes as a consequence of the pandemic. So our team consisted of 13 professions, 23 students, and we had representation from a diverse group of individuals that allowed us to make sure that the voices in the room represented the population that we were serving. We had over 54 faculty champions, and again, we were able to represent all 8 colleges. With our work with COVID-19, however, it allowed us to expand our work to include all campuses from from the OU campus. So the Norman campus, as well as the Oklahoma City and the Tulsa campus. The goals that we had when designing the new structure was a safe and meaningful experience for students, patients, and providers, equitable patient interaction for our team members, and quality IPE experience. And there were a slew of challenges that we faced in order to be able to actually deliver that care. And that would not be possible without exceptional leaders such as Addison Davis, who served as the chair of operations for the Unity Clinic for the past year. So I'm going to hand it over to Addison to talk a little bit about the work that she and her team did in order to make the clinic feasible. Addison?
Yes, thank you, Daniel. Before I begin, I just want to say how I'm grateful that I am to be a part of this trailblazing mission and that Daniel entrusted me to take on this huge role, especially in the middle of a pandemic. I've got to work with him amongst many other student leaders, and I've got to know his heart and his mission behind this. And the guy doesn't quit. So I am just privileged to be here and to talk to you all today about what we have done to overcome the pandemic and the challenges. So Daniel, if you want to go into the next slide for me. One of the main things with COVID-19 was transitioning to telehealth. We weren't able to have students, all of us in the clinic. We had to maintain social distancing, protective measures. And with that, how were we able to still see patients and give our fellow Oklahomans quality care that they needed without affecting them or spreading the disease? So transitioning to telehealth was essential for us to be able to continue our mission and our goals to provide our patients with exceptional care. We were able to host medical students, pharmacy students, and social work, nutrition, many professions on telehealth services. The patients were able to converse with the providers over Zoom, and patients were thus able to receive the care that they needed. Next slide, please. And then the optimization of clinic patient capacity. So now as we are transitioning to the state of herd immunity, the pandemic is not over, but we are seeing the light at the end of the tunnel. So with that, we are able to bring more of our students on the ground and really assess what we needed to do to serve our neighbors and our fellow community members. And something that was really close to our hearts was reaching patient capacity. And what do I mean by that? So we were seeing on average about 3 to 4 patients a night per clinic, and it was something that was identified by our leadership, our operations team, along with the exec, that we wanted to up that number. We thought that we were doing more, we could do more, and so how are we going to do that? And that's where I really was able to come in with my team on the operations side of things and say, okay, this is the workflow along with Daniel's help that we need to do to see the mass capacity of patients that we are able to handle with that. So now we're averaging about 6 patients a night between 2 providers, and that's been something that has drastically increased our quality measures and our patient capacity. And the next thing that I want to talk to you about is process improvement. So as we are seeing more patients, there's going to be hurdles and transitions to overcome as we optimize this workflow. So we're doubling our capacity. We have to change some things around. That's just kind of the name of the game. With that, we had to change to that 2 clinical team model, the restorative team, which consists of occupational therapy, physical therapy, that we were hoping to have in the clinic, giving these patients nutrition services, and the dental team too. So, and I really want to take this time to emphasize that the care that these patients are receiving at our facility is so exceptional, because otherwise they would be having to take off work for multiple days to see specialty care, individual care for PT, OT, nutritional services. These patients are getting counseling on, so our diabetic patients, we have a heavily increased number of our patient population is heavily diabetic. With that, they are getting counseling from nutritional sciences. They can make their dental appointments and come back with that and see them. And with that, they are taking all of this care that they would need to schedule over the span of 3 to 4 months, and we are compiling it into an hour-long clinic visit that still addresses the quality measures and ensure that these patients are getting the care that they need in a time efficient and mannerly way. So next slide, please. And then the last thing that I want to talk to you guys about today, and that I've had the privilege to do, is the strategic management focused clinic coordination. So with that, I have had the opportunity as the chair to really have that perspective outlook, to assess our opportunities, our threats, where can we grow as a clinic, where can we not grow as a clinic, do we need to bring in more translators for our patients, do we need to assess something that's going to bring our students more benefit, our providers more benefit, or our patients more benefit. So maintaining the strategic management outlook and assessing the opportunities that we have has been crucial in the success of Unity Clinic.
Thank you, Addison. And one thing that I want to point out regarding everything that she spoke about is the flexibility and the importance of communication as a lot of this happened. And with that, that would not be possible without individuals like Addison that were on the ground making things happen, as well as our administrative chair. So Tram is one of our second-year medical student leaders who has been serving as the administrative chair for the past year. And she played an exceptionally crucial role, not just for the sake of making sure that the team was up to date, but how do we bring the work to life as things change on a nightly basis. And so I'm going to pass this over to Tram to talk a little bit about the work that she has done, as well as the impact that we were able to have on our community. So Tram.
Thank you, Daniel. So as we all know, efficient team collaboration can really only be carried out by constant and effective communication. And with the pandemic and the changes it forced on our clinic process, that made communication even more imperative for the success of our clinic. So to address this, we developed a centralized hub for volunteers to access documents and videos pertaining to our clinic, as well as any information regarding their specific role within the team based on their profession. And this can all be found on our Unity Clinic D2L page. We also communicate any updates and weekly schedules to volunteers on a regular basis using our Unity Clinic email. And all of this has been standardized by the delegation of the administrative chair and volunteer coordinator roles. Next slide, please. The incorporation of so many professions also required a standardized approach to scheduling volunteers that met the specific requirements of each college, while also maintaining profession representation within each of our clinical teams. So this year we were able to develop a process for doing so, and we continue to refine our process with even more sophisticated scheduling platforms, such as REDCap in the next year. We've also had the privilege this year of working with medical residents from the family medicine program here at OU, and we're able to incorporate them into our faculty schedule as medical clinicians. So with all the adjustments we've made in response to the pandemic this year, the Unity Clinic was still successful in incorporating 8 professions, working alongside over 20 faculty on campus and volunteering 260 clinical hours this year. And through a cumulative 65 clinic schedules, we've hosted over 350 students to serve over 200 Oklahoman patients. At the same time, our efforts were recruited in fighting the pandemic through our vaccine clinics. So over the last 3 months, since the approval of the COVID-19 vaccines, the Unity Clinic team and its student leaders have helped to host 5 injection trainings to over 200 students from both the colleges of medicine and dentistry. We were able to also build partnerships with various entities, both on campus and within our community, including OU Health, First Church of the Nazarene in Oklahoma City, Good Shepherd Clinic here in Oklahoma City as well, and our friends in OU Norman. And with interprofessional collaboration still at the top of our priority list, we have since helped to lead over 25 vaccine clinics, excuse me, in which we've coordinated students, volunteers representing various colleges, including the colleges of public health, medicine, dentistry, allied health, the graduate college, the list goes on. And through all of these clinics, our students were able to administer over 20,000 shots to Oklahomans, and contribute 5,200 volunteer hours through the vaccination efforts. And so to talk a little bit more in detail about the operations of our vaccine clinics and how we've optimized that, I'll pass the torch off to Addison.
Thank you, Tram. So operations still had the opportunity to be involved with the vaccine clinics, which I was so privileged to be a part of, along with our other health administration students. So our role here was really to focus and hone in on the organization and optimization of the non-clinical side, making sure that when patients were entered that door, they were greeted not only nicely, but efficiently. Their paperwork was conducted and processed efficiently. They headed to the correct place to get in line to get their shot, and that they were all socially distanced and wearing masks at the same time. And you can imagine with 20,000 shots over 25 clinics, that was a challenge in itself. But we got it done. And some of the things that I wanted to highlight on for me and my team was the process improvement. We changed the model several times of the vaccine clinics, that especially the community partnerships, those are a little bit more smaller scale, but with the direction of OU Health and our collaboration and that effective communication, we were able to get a lot of Oklahomans vaccinated.
So where do we go from here? We have been able to accomplish a lot for the past 2 years, given that we've dealt with a global pandemic, as well as the need to create new and innovative structures that allows meaningful interdisciplinary collaboration. So one thing that we are looking forward to doing is taking the work that we set out to do and bringing that to fruition, and looking back at the milestones that we set for ourselves. we have created a sustainable, replicable, and standardized clinic model, not just for a ideal clinic setting, but also for during emergency situations like the COVID-19 pandemic. Integrating the Unity Clinic into our Health Sciences Center. We're already incorporating this clinic into curriculum within College of Nursing, College of Medicine, Allied Health, and College of Pharmacy. So as we expand the work that we're doing, it is going to allow for ideally every single student on our Health Sciences Center to be able to go through this experience and learn to work together on an interprofessional team. Lastly, the next step that it really brings the team together and serves as the foundation of the Unity Clinic is the mobilization effort. We've been fortunate to receive a $1.1 million HRSA grant that allows us to purchase a mobile outreach vehicle. With that, we're excited to partner with stakeholders on our campus and in our community to be able to not only serve the community at large in the state of Oklahoma, but in addition to that, help recruit individuals from these underserved areas to come into healthcare professions so that they can continue to serve the communities for the years to come. And with that, in addition to the community outreach element that we've done, we're incorporating new training so that we can better serve the community that we're seeing. So we are putting together an LGBTQ plus simulation that allows our team to be able to take care of patients from that population in a more effective and inclusive way. We're creating a trauma-informed training and simulation, which also serves to allow our students to have the tools that they need to take care of patients from those populations. With our community outreach efforts, the work is still ahead of us. There's a lot of work left to be done, and there's a lot of need that still exists in our community. And so what excites me so much about these coming years is that as some of the leadership changes, as we're able to incorporate new students into our into the vision and allowing them to bring this work into fruition, we're able to reimagine the vision that we had 3 years ago and propel us forward to beyond anything that we could imagine. None of this would be possible without individuals within the community, such as Pam Timmons, who is the executive director for the Good Shepherd Clinic, Avarilla, who has been our partner from the First Church of Nazarene, allowing us to have the very first community outreach clinic by the Unity Clinic. And so through these partnerships, we're excited to not only serve the community, but really transform the educational system within the state of Oklahoma and the nation as a whole. So I want to thank you for taking the time to join us during this session. And I'm excited to see where our team is able to take this work in the near future. So thank you.